You know, we are standing right on the edge of a medical revolution. We're talking about a technology that doesn't work from the outside in, but from the inside out. A tiny device that travels through the human body to find disease and even to heal it.
I know what you might be thinking. It sounds like something straight out of science fiction. Maybe a movie like Fantastic Voyage. But what if it wasn't fiction anymore? What if you could swallow a single pill that could diagnose a condition, deliver a precise treatment, and then report its findings back to your doctor, all from inside of you?
All right, let's cut right to the chase. For anyone short on time, here's the essential takeaway in the next 60 seconds. We are entering a new era of medicine, one that's personalized, minimally invasive, and it's a lot closer than you think.
At the very heart of this revolution is what's being called the smart pill. Now, don't think of it as just a drug. It's really a complex electronic device, a miniature machine that's small enough to swallow with a simple glass of water.
And its entire mission, its whole purpose, is carried out from inside your gastrointestinal tract. This gives it incredible access to all those winding, hard-to-reach parts of the body, places that have always been a challenge for our traditional diagnostic tools.
So, here's what makes it a potential game changer. It has this incredible triple threat capability. It can sense the signs of disease, it can act by delivering medicine or taking samples, and by doing all that, it really could change how we manage our health for good.
Okay, so now that we know what it is, let's dig into the really fascinating part. How does it all work? How on earth does a tiny pill do the job of a high-tech diagnostic lab?
Well, the power of this technology really boils down to three core abilities that are being developed as we speak. The power to sense disease, the precision to deliver drugs, and the capacity to perform a biopsy without invasive surgery. Let's break each of this down.
First up, sensing. So how does a pill see disease? Well, many of these capsules use a clever technique called bioimpedance. They send a tiny, completely safe electrical current across the lining of your gut. Now, healthy tissue has a certain resistance to that current. But inflamed or diseased tissue, well, it's more permeable, a little more leaky. By measuring that change, the pill gives doctors a direct look at inflammation caused by things like inflammatory bowel disease.
Next up, drug delivery. With this, it's all about location, location, location. Once the capsule gets to the exact spot where the problem is, a tiny internal mechanism kicks into gear. A set of microneedles, and we're talking incredibly small here, deploys from the capsule and injects medication right into the affected tissue. This means maximum impact where you need it and minimal side effects everywhere else.
And then there's the biopsy. This might just be the most ambitious function of all. You know, a traditional endoscopy is invasive, it often requires sedation, and it's not exactly comfortable. A capsule biopsy, on the other hand, is a total game changer. A patient just swallows it, no sedation, it can travel the entire GI tract to get a tissue sample. Think about what that means for making crucial screenings more accessible and way more affordable.
But let's be realistic here. This incredible vision isn't a reality just yet. To get these devices from a research lab into your local clinic, there are some pretty formidable engineering challenges that have to be solved first.
The biggest headache, the number one problem, really comes down to one thing: power. The battery needed to run all the sensors and little motors inside is a total space hog. We're talking 30, sometimes up to 50% of the capsule's entire volume. That leaves very little room for the actual medicine or the biopsy tools.
And don't just take my word for it. A report in the engineering journal IEEE Spectrum puts it bluntly, saying that these advanced functions may demand more power than current capsule batteries can provide. That power problem is the central bottleneck that researchers are working around the clock to solve.
And power is just the tip of the iceberg. I mean, you've also got to worry about making everything even smaller. The materials have to be completely safe for the body. You have to be 100% sure it won't get stuck. Plus, you need to get reliable data from the incredibly harsh environment of the gut. And then you have to navigate the long, complicated road of regulatory and insurance approval.
So, yeah, the hurdles are significant, absolutely. But the vision for what's on the other side is what makes it all worth it. This isn't just about a small improvement. It's a fundamental shift in how we think about internal medicine.
You know, this idea didn't just appear overnight. The journey here has been decades in the making. From the very first swallowable radio transmitters back in the 50s, all the way to the pill-cam video capsules that became a real clinical tool in the early 2000s. The prototypes being built today are that crucial next step toward a future of routine, at-home screenings and disease management.
If you really want to understand the real-world impact this could have, why this isn't just some cool new gadget, I want you to remember one number:
41%. What is that? Well, as of 2021, that was a percentage of eligible adults in the United States who were not up to date on their colorectal cancer screenings. The reasons are pretty simple: cost, inconvenience, and, let's face it, the invasive nature of the procedures. An ingestible capsule could potentially wipe away those barriers for millions of people.
And that's really the ultimate vision here, isn't it? It's about taking diagnostics and treatment out of the specialized hospital setting and bringing it right into a patient's home. This technology represents a future where healthcare is more proactive, less invasive, and deeply, deeply personal. Which leaves us with one final, and I think pretty profound thought. We're on the verge of a world where some of our most advanced medical care could be delivered by a device you can literally hold in the palm of your hand. So the question we really have to start asking ourselves is, how will our relationship with medicine itself change when our doctors are finally small enough to swallow?